So we just talked about the alpha receptor. In this section, we're going to talk about the beta-adrenergic receptor. And as you can see, when epinephrine binds to the receptor, the end result is increased concentration of cyclic AMP. So we get activation of protein kinase A, big signaling pathway. So stimulatory. Beta-adrenergic receptor can be beta 1, beta 2, and beta 3. And when you activated these receptors, you get activation of adenylyl cyclase, increased conversion of ATP to cAMP, activation of pKa. Also, you get influx of calcium. So all stimulatory. So beta 1 receptors predominate in the myocardium, the SA node, the ventricular conduction system, and they also mediate the effects of catecholamines on the myocardium, specifically the beta 1 receptor, are sensitive to both epinephrine and norepinephrine. But this is not the same as beta 2. Beta 1, so equally sensitive to epi and norepinephrine. Beta 2 receptors are located in the smooth muscles of the vessels, in the skin, muscle, mesentery, bronchial smooth muscles. And when you stimulate them, you get vasodilation and bronchial relaxation. You get relaxation of the smooth muscle, essentially. Beta 2 receptors are more sensitive to epi than they are to norepinephrine. Beta 1 receptors are distributed to the postsynaptic sites only. So there is no presynaptic beta 1 receptor. They're all postsynaptic. And presynaptic receptor are beta 2 subtypes. But beta 2 can be either presynaptic or postsynaptic. So when you activated the beta 2 receptor, the presynaptic beta 2 receptor, you get increased endogenous norepinephrine release. But when you block it, you'll inhibit the release of norepinephrine. The postsynaptic beta 1 receptor responds primarily to neuronal norepinephrine, not the circulating norepinephrine. The postsynaptic beta 2 receptors, very similar to postsynaptic alpha 2 receptor, respond primarily to circulating epinephrine. So when you give IV epinephrine, you're primarily going to affect beta 2 receptor as opposed to the postsynaptic beta 1 receptors. So in the cardiovascular system, let's look at myocardium. There's both beta 1 and beta 2 receptors. And they're both functionally coupled to adenylyl cyclase. Postsynaptic beta 1 receptors are predominant in the myocardium, the SA node, and the ventricular conduction system. The beta 2 receptors have the same distribution but are presynaptic. So the effects of norepinephrine on inotropism in the normal heart is mediated entirely through the postsynaptic beta 1 receptors. The inotropic effect of epi are mediated through both the beta 1 and beta 2 receptors in the myocardium. And again, right now we're just talking about myocardium, not the blood vessels. Beta receptors may also affect chronotropism response to epinephrine. What about peripheral vessels? The postsynaptic vascular receptors are virtually all beta 2 type. And they're located in the smooth muscles of blood vessels of skin, muscle, mesentery, and bronchi. When you stimulate these postsynaptic beta 2 receptors, you get relaxation of smooth muscles, so you get vasodilation and bronchial relaxation. What about kidneys? The kidneys have both beta 1 and beta 2 receptors, but have a higher preponderance of beta 1 receptors. And it results in, when you stimulate it, get release of renin from the juxtaglomerular apparatus. So beta 1 receptors evoke release of renin. Renal beta 2 receptor also appear to regulate renal blood flow at the vascular level, which mediate a vasodilatory response.